بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. This is the second part of epistaxis, the definitive treatment of epistaxis, the main aim of identifying and directly treating the source of the bleeding. Look into the nasal cavity and locate the point of epistaxis after packing the nose with 4% xylocaine and 1 in 1000 adrenaline mixture. Cauterization. We have two types of cauterization, either chemical cauterization like silver nitrate, stick and chromic acid, and they are used for trivial mild epistaxis when there is a raw area or dilated vessels, while electrical cauterization is used for severe active epistaxis. Larger vessels generally respond more readily to electrocautery. However, it must be performed cautiously to avoid excessive destruction of healthy surrounding tissues. Use of electrocautery on both sides of the septum may increase the risk of septal perforation. After cauterization, we apply an ointment and advise against blowing and nose picking. This picture shows the use of bipolar cauterization. We should avoid unipolar cauterization because of the risk of septal perforation, and the propagation of the electrical current can cause blindness. Anterior nasal packing used if we are unable to control the bleeding by cauterization. We can use ribbon gauze impregnated with PIP. PIP consists of bismuth iodoform paraffin paste. Also, we can use ribbon gauze impregnated with paraffin or with any antibiotic ointment. We can use tampon, nasal tampons, and nasal balloons and catheters. This picture shows the insertion of the anterior nasal packing. Using the ribbon gauze, we put the ribbon gauze in layers to control the anterior epistaxis. Also, we can use the nasal tamponade and can use the nasal balloons and catheters. Other treatments to control epistaxis by using hot water irrigation at degree of 50 degrees centigrade with use of specialized irrigation catheters. It involves reflex vasodilatation and reduction in the nasal lumen dimensions. Similar levels of success comparing the hot water technique to anterior nasal packing and balloon tamponade. We can use topical hemostatic agents like Flosil hemostatic matrix, which consists of gelatin and topical thrombin compounds, used as an additional tools for management of difficult epistaxis. This picture shows the application of Flosil into the nasal cavity after insertion of the Foley's catheter to prevent spillage of Flosil into the pharynx. The posterior nasal packing is used if the bleeding is posterior, and it should be done under GA. We can use Foley's catheter or other inflatable devices, and the packing should be left for at least 48 to 72 hours, and the patient with posterior nasal packing should be admitted in the hospital with the use of antibiotics to prevent secondary bacterial infection, especially by Staph aureus, and the transfusion, blood transfusion might be indicated in severe intractable epistaxis, And the blood gas analysis is indicated in children because of the risk of hypoxia. And this picture shows the insertion of the postnasal packing. We insert the postnasal packing under GA with anterior nasal packing. Sometimes we can use the Foley's catheter instead of the posterior nasal packing with anterior nasal packing. Also, we can use nasal balloon and catheter with double balloon. Complications of nasal packing are infection, loose pack obstructing the airway, and hypoxia. Surgical management, like ligation techniques, it is reserved for intractable bleeding where the source cannot be located or controlled by techniques described above. It includes ligation of the following arteries, like ligation of sphenopalatine artery, it is the most common type of ligation, or ligation of the internal maxillary artery, external carotid artery, and sometimes ligation of anterior and posterior ethmoidal arteries. Ligation of these arteries depends on the site of the epistaxis. Septoplasty, when epistaxis originate behind a prominent septal deviation. Embolization under angiographic guidance to control severe epistaxis, and it is reserved for failed ligations. The best clinical practice in management of epistaxis, the first line is the direct therapy with the use of bipolar cauterization, and the second line is indirect therapy by using anterior nasal packing, and the third line is the surgical therapy like endoscopic sphenopalatine artery ligation, and the last resort and the fourth line is the embolization. How to avoid and prevent epistaxis? By avoiding damaging the nose and excessive nose picking. Seek medical treatment for any disease caused the epistaxis, and get a humidifier if you live in a dry hot climate. أعزائي الطلبة، هذه المحاضرة الأخيرة من محاضرات العام الدراسي 2019-2020. أنا مستعد لأي سؤال أو لإعادة أي محاضرة أو شرح أي موضوع يصعب عليكم. أتمنى لكم دوام الصحة والعافية والسلامة. Take care and good luck.